Dive into the essentials of tropical medicine in our latest video, A Beginner's Guide to Tropical Medicine, simplifying the complexities of diagnosing and managing diseases in tropical environments. From common diagnoses to risk assessments, we cover crucial steps. Learn to navigate endemic diseases and recognize the importance of geography. Tropical medicine may seem daunting to those not familiar with treating diseases in tropical environments. However, with the right approach, clinicians can safely diagnose and manage patients even with limited resources. In this beginner's guide, we'll walk through the key steps for approaching tropical medicine cases. When faced with a sick patient in the tropics, first consider the common diagnoses you would evaluate at home. Could this be a routine infection like a urinary tract infection or pneumonia? Or are there red flags making you worried about a more serious illness like sepsis or diabetic ketoacidosis? Then consider the conditions specific to the tropics in your differential. Manage these normal conditions aggressively, as they can deteriorate rapidly in tropical settings. Also recognize that tropical diseases can mimic routine illnesses, so maintain a high index of suspicion. Certain diseases are more prevalent in specific tropical regions. For instance, malaria is a huge concern in sub-Saharan Africa, while Chagas disease is rare outside rural South America. Create a mental map highlighting endemic diseases in the areas where you work. Consider making a table or quick reference guide you can consult. This geographic framework helps narrow down the possibilities. Take time before, during, and after trips to tropical regions to assess risk factors for individuals and groups. Pre-trip recommend vaccinations, malaria prophylaxis, trip insurance, and so on. Educate on bite and wound prevention. Consider living conditions and trip activities. For example, are you going to risky locations such as caves with bats in them? Are you going to be in stagnant water where leptospirosis and other water-related diseases are prevalent? Have there been any known outbreaks of disease such as dengue? Read up on these conditions before you go. During monitor for insect bites, fevers, and diarrhea. Emphasize hydration and wound care. Check water sources and living quarters. Encourage good public health and prevention practices. Post-trip advise travelers to seek care for any new or persisting symptoms. Stress the importance of sharing their travel history. When faced with a patient in the tropics, break down the possibilities into normal appendicitis, pneumonia, urinary tract infection, big sick sepsis, diabetic ketoacidosis, severe dehydration, tropical malaria, typhoid, amoebiasis, and parasites. Use the geographic framework to highlight relevant tropical diseases. Also factor in timing. An acute fever is very different from one persisting for months and can give you clues as to the potential cause. Learning the life cycles of tropical bugs like schistosomiasis helps you logically link symptoms and exposures. If a patient swam in a contaminated waterway known for schistosomiasis, a subsequent rash, cough, and gastrointestinal distress would make sense. You don't have to diagnose every tropical disease definitively. The priority is identifying red flags and conditions requiring higher-level care. Initiate emergency referrals when appropriate and ensure thorough follow-up for any lingering or unexplained symptoms. A common pitfall is to assume someone's symptoms are not related to travel because months or years have passed. This is not always the case, and you may need to advocate for the patient if their symptoms persist. The key is breaking tropical medicine down into systematic steps. With the right knowledge and approach, you can provide safe care even in low-resource settings far from home. Consider enrolling in one of our training courses to further prepare for the jungle and wilderness. The Basic Wilderness Life Support course is a great way to learn more about the skills and knowledge you'll need for your next adventure in the wild.